first, what is a biochemical pregnancy? I get a lot of, questions about this. I've done videos on it before, but
Yeah.
what is a biochemical pregnancy?
It's basically an early miscarriage. It's an embryo that was beginning to implant, started secreting HCG, but never got past the point where you could actually see it inside the uterus.
Mhm.
In order to be able to visualize a pregnancy, your HCG level has to be able to get to 1,000.
Mhm.
Normally people say 1,500, but our machines at RMA are really good.
Mhm.
So I say
Yeah,
1,000.
good. Really, yeah.
We should be we should be able
Yeah.
to see a sac, right?
Mhm.
And so if your levels never got beyond that point because they got to 500 and then they started declining because
Mhm.
the pregnancy started to, stopped growing and stalled.
And biochemical pregnancies became more, actually aren't more common probably, but became more common because of the use of IVF, because of following the HCG levels,
Tracking.
right?
100%.
Yeah, tracking. Yeah.
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 Mhm.
Yeah, a lot of times they go unrecognized. Someone asked me
Mhm.
this the other day when I was doing a Q&A. How do I know if I've ever had one? You don't. I mean,
Mhm.
there are some clues, but it can be hard to decipher because
Mhm.
not every delayed period or really heavy period is because you're
Mhm.
having a biochem. I'll have
Right.
patients sometimes come to me and say, I had a biochemical pregnancy. I'm like, did you ever take a pregnancy test? And they're like,
Mhm.
no, but my boobs
My
hurt and I had this
period, yeah.
delayed. Yeah, and I'm like,
Yeah.
well,
I
I
know.
don't
I get
know.
it too. Yeah. And I
Yeah.
teach the residents and medical students, and you're interviewing with someone and they tell you they have, this number of pregnancy losses. I go through
Yeah.
every pregnancy loss because it's important
Yeah.
for me to know, was the biochemical, did they ever see a sac? Did they ever see a heartbeat? How far along they were. And so many times they'll say, well, my period was late, but I felt like I was pregnant and I had a positive pregnancy test. But, so all of that helps me determine, I'm sure you as well,
Yeah. Yeah.
what exactly was going on. Because technically for recurrent pregnancy loss or a diagnosis or a workup of
Mm-hmm.
potential recurrent pregnancy loss, we don't include biochemicals. And that's just
Right.
because, again, they're so early.
Mm-hmm.
That they're not considered to be part of what's would be included in a recurrent pregnancy loss workup. But like we just mentioned, because of the use of IVF and obviously tracking
Yeah.
HCGs, we're going to see a lot more of those.
Yeah.
Right.
Yes.
Yeah.
And because of the
Yeah.
nature of what I do and the fact that we're checking things and being so much
Mhm.
more controlling with
Mhm.
everything, I actually will do a recurrent pregnancy loss workup in patients
Mhm.
with 2 or more biochemicals just because I
So
think the
that was the
stakes are
other
just
thing.
really high.
Well,
Yeah.
because they're already going through IVF for a reason,
Yeah.
right? So they're
Yeah.
already going through that IVF for a
Correct.
reason. So that might be more of an indication. But my
Yeah.
patients, if I'm seeing them, that's
It's
usually not
totally
the case.
different.
Yeah,
Yep.
it's different. So if you're having multiple chemical pregnancies after 40, is that to be expected? Is it because it's assumed to be chromosomal, or is there something else to look for? That was the question. One of the questions.
Yeah, I would expect or assume that it's probably chromosomal abnormalities,
Yeah.
but definitely if you've never had a proper evaluation of your uterine cavity, it can't hurt to just rule
Yeah.
because you could have more than one thing going on. Yes, age is a
Yeah.
factor, but
Mhm.
it's not fair to just hand wave and ignore all the other
Mhm.
possibilities. Like I've
Yeah.
had
People
patients in that
have
exact situation who've
mhm.
had a fibroid sitting right in the middle of their cavity. And I'm like,
Yeah.
well,
I
I don't know if it
mean,
was a
people
fibroid.
after 40 deserve an infertility workup as well. And we can't
Exactly.
always assume it's because of age, especially if you've never had a child before. Because say you
Yeah.
delayed childbearing for whatever, and you are trying for the first time after 40 and you never had a reason to know whether or not you could get pregnant. And then now you're having, whether they're biochemical or other forms of pregnancy loss, we can't
Yeah.
just say, oh, you're 40.
Yeah.
That's to be expected, right? We still deserve, that patient still deserves to have the workup that anybody else would. Is
Yeah.
it more likely that genetics could play a role? Absolutely. But
Yeah.
that doesn't mean we dismiss everything else.
Well, it's just like
And now,
patients who have irregular cycles, right?
right.
They'll come to me and they look at me like I have 2 heads when I'm like, your husband needs a semen analysis. They're like, but I'm the problem. And I'm like, but he might be as well. You just don't know.
Yeah.